Hi everyone, this is Odyssey. Welcome back to my channel. Hello from Germany. Taran! Girl, chismisan lang tayo. Magkukwentuhan lang tayo. This is just gonna be a work life update, ganyan. So, you know na since October, I've changed facility, I've changed station. So, ayun na naman. Nag-adjust na naman si ate girl, stress na naman si ate girl. And I wanted to keep you updated about it. So, currently, I'm still in training. So, this is very new to me kasi wala naman akong experience sa cardio, and I always share na I don't have a hospital experience. So this is really a very big thing to me. Although I am a registered nurse in the Philippines, I did not pursue the profession, so I changed really into a different career. And then when I moved to Germany, dito lang ako ulit nag-start na maging nurse. So just to give you a background for those new na hindi pa masyado nakapanood ng mga previous vlogs ko, I started working sa Seniorhomes for 2 years. And then April 2023, lumipat na ako sa hospital. I started working sa orthopedic station. And then October 2024 is andito na nga tayo. So I'm currently working in Hertz Catheter Labor or Cathlab. Siguro mas madali yun intindihin sa English. So the vlog today would not be talking about in details yung Aufgabe, just an overview about it, but rather I wanted to show you, I wanted to kumbaga narrate to you on how does it feel like for someone na wala nga ng hospital experience, for someone na starting over as well being a nurse. So, just a little background, what's catheter labor? Ano bang station na to, girl? So, Hertz catheter is actually a diagnostic lab to check yung function ng heart. We're talking about yung mga arteries, ganyan. Meron na ba ng blockage? We're checking yung blood flow. Ano ba yung input versus output? Meron ba ng difference? Relevant ba yung stenosis? Kailangan ba bigyan ng intervention? Like, kailangan ba lagyan ng stent? Kailangan ba lagyan ng balloon? Paano yung mga mitral valves, tricuspid valves, nagpa-function pa ba? Yung complaint ba ng pasyente na DOB, difficulty of breathing, dahil ba sa lung function o related na ba siya sa heart? Kailangan ba ibare na yung artery? That's Hertz catheter labor. Para madugo, oo girl. Bakit mo kasi pinili yan? I made hospitation. And then I really felt na gusto kong ma-experience siya. Oo, mahirap, pero ayun na nga, kakayanan natin. What are the procedures that we do? So we do have, halimbawa, coronary angiography, which is just Darstellung, x-ray lang talaga ng mga heart arteries to check if meron ba ng mga blockages, stenosis, etc. We also do myocard biopsy. Halimbawa, a patient who had heart transplant, syempre kailangan sila i-kontrole lagi. So we do take gewebe or tissue sa heart muscle so that we can check it if okay ba, hindi rin-inject ng body mo yung heart transplant. We also do Recht Hertz catheter. We also do mga intervention. Lalagay ng clip like mitral clip, tricuspid clip, mga ganon. And then we also do mga intervention like naglalagay ng stent, naglalagay ng balloon, or halimbawa grabe yung calcium deposit sa artery, kailangan ba ibarena, kailangan ba ng sound wave therapy, etc. Those are the things that we do. So how is it being done? So I'll show you a video that I got from YouTube. How is it being done? Mas na-explain nila na maayos kaysa sa akin. These are my favorite these days kasi kailangan ko siya pag-aralan, kailangan ko siya intindihin on my own so that I would be able to understand better kung ano ba yung pinasok ko at mas magawa ko na mabuti yung trabaho ko. The main of GABE is really forbereiten ng pasyente. Meron pa ba siya ng kailangan i-clarify sa procedures o kailangan mo i-explain yun? Forbereiten alin yung functions tele, syempre yung mga materials na gagamitin, aling catheter yung gusto ni doc, etc. Mga medikamente na kailangan natin ibigay pre-procedure or during the procedure as well. And of course, assisting ng doctor during the procedure. Kasi ikaw din kumbaga yung pang-apat na mata niya. During the procedure, lalo pa pag intervention o lalo pa pag severe case, yung mga doktor is that they only have a tunnel eye dun mismo sa ginagawa nila. But you have to check yung condition ng patient, you have to check yung monitor, kumusta yung ECG, kumusta yung x-ray, lahat ba ng material, enough pa ba or kailangan mo ba ng something, whatever. So you are the one communicating all those things too. So ayun, laban-laban si Toy. Ay, talaga naman. The work itself demands na mag-aral kasi grabe, yung mga colleagues ko, no, who had been there for like 1 year na, 5 years na, parang andali na lang sa kanila. Kung baga ako nagpapanik pa, sila, girl, kalmado na lang talaga. Alam mo yun, ang bilis na nila mag-interpret ng ECG, girl. Or halimbawa, syempre, fina-follow mo yung procedure, no, nakatingin ka din kung ano na yung ginagawa ng doktor, ganyan. Alam nila kung nasaan na kami. Halimbawa, ay, nasa pulmonary artery na tayo. Ay, pumunta na tayo sa ventricle. Ay, talagang, paano mo nalaman yan? Even kung ano itsura ng ECG, depende kung saang artery pumunta yung doktor. Girl, alam nila, girl, talaga na. Kaya talaga namang, ay, doble kayod sa pag-aaral si ate, girl. And really, pag may question, kailangan talagang maklarify. Kasi minsan, may doktor, halimbawa, naka-assist ako, no? Tapos, nagtanong, nafa-follow mo ba yung procedure? Alam mo ba kung aling artery yung may stenosis? Ay, girl, kailangan sumagot tayo. And even some of my colleagues, of course, they ask if talagang naiintindihan ko. Kasi this is a special area. So, ayun. Kailangan pangalagaan natin yung pasyente. So, girl, first week ko dito, ay nako talaga, lahat ata ng severe cases nakita ko during that time. So, the first week really is parang trying to settle in, parang kumbaga more on observation ka lang, ganyan. Of course, you're gonna do something, pero still just settling in, parang just uncommon pa lang, nag-arrive ka pa lang dun ganyan. So, andun ulit yung parang adrenaline rush, andun yung na-open up yung insecurities mo kasi nga wala ako ng hospital experience, andun yung hindi pa ako confident, ganyan. So, really talagang yung first week parang hindi mo ata ako makausap, girl, ganun. One of the severe cases that we got, I think, meron ng emergency case, unconscious yung patient na tagpuan lang sa airport, tapos dinala dun sa facility namin kasi nga unconscious siya, no? So, kailangan maglagay ng ECMO. So, hindi ko pa nga ito nakita sa Pilipinas and even in my nursing years, Grabe, parang yung mga nakikita mo talaga sa Grey's Anatomy or wherever, sa movies lang. So, pagpasok ng pasyente, no, ang dami ng team, andyan si anesthesia, andyan si emergency team, andyan si ECMO team, and us nga na cardio team. So, parang chaotic, sobrang dami ng tao. So, meron na lang ng machine na nagsi-CPR sa pasyente all throughout the procedure, ganyan, kasi talagang hindi na nagpa-function yung heart. So, since hindi na nagpa-function yung heart, meaning hindi na na-provide ng oxygen yung mga vital areas. And critical na siya. So, ang main of gabi ng doktor is that he needs to have an access sa artery and vein so that yung blood circulation would be reinstated again. So, yung ECMO machine would be the one providing oxygen and mag-resorg na ng blood flow sa buong katawan ng pasyente. So, imagine my shock during that time na talagang sabi ko dun sa isang doktor, stay in orbite of the eke kasi talagang sabi ko, shop does not niche or live. Hindi ko pa kako yan na experience and talagang medyo nagpapanik talaga. So, those type of cases, and then again, another ECMO patient. So, kumbaga, yung anxiety mo, bumababa siya as long as na-experience mo siya ng paulit-ulit. So, kumbaga, alam mo na yung mga kailangan gawin, alam mo na yung mga materials na kailangan i-prepare. And if I'm looking back, first week versus now, yung first week na talagang kainaanong ako, ngayon naman at least baga nakapag-assess na ako sa doktor, sa coronary angiography, alam ko na yung flow, alam ko na yung procedure, alam ko na yung routine, alam ko na yung mga materials na kailangan ko prepare. Halimbawa, may rash starts catheter, may biopsy, ano yung mga kailangan kong i-first sort, ganyan. Nakapag-dana na din ako ng balloon. Paano ba ginagamit yung mga devices, etc. So, I still have maraming bigas na kakainin. Ang dami ko pang kailangan alamin. But, though it's stressful, though it's mahirap, andun ako sa part na na-excite ako kasi ang dami kong natutunan na looking back at myself 10 years ago na hindi nag-nurse, and then now na kumbaga na-feel ko na nurse na ulit ako. This is a milestone for me. So, ayun lang. That's just really that I wanted to share this journey of being a Filipino nurse here in Germany. May you also find a station kung saan mo ba talaga gusto. Kasi marami naman talaga dyan. Really, you have to find it. Go lang, girl. Mag-observe ka, mag-hospitasyon ka, and then just, look where you wanted to grow more. Ganon. So, I was talking to my colleague, who is also in Anerkennung, kasi nga, nagsisharean kami ng stress namin sa work, ganyan. She also shared na sabi niya, wala naman girl na nagsisimula sa day 100. So, kahit yung mga doktor na yan, nagsimula yan sa day 0. So, we have to, kumbaga, give ourselves some grace then and kindness, especially pag nagsisimula tayo somewhere new na wala pa tayo na experience. So, ayun lang. Parang kumbaga sa umpisa, para siyang malaking puzzle, na wala ka ng idea, paano ba ito gawin, paano ba gamitin yung ganitong device, alin ba yung mga kailangang material ng mga doktor, etc. But knock on knock, that puzzle, parang ma-figure out mo lang siya. The most important part is that you show up kahit gaano ka kapagod, kahit gaano ka pa ka-stress, pero the more that you show up, day by day, mas matututo tayo. And then, you would just look back on those experiences. Those are pala birth pains lang, and then they're just trying to prepare us para maging better tayo sa ginusto nating tinahak nating path. So thank you so much for dreaming with me, for being with me today. I hope I'll see you on the next. This has been Odyssey. Cheers!